Some patients and many doctors and nurses will not be surprised to learn that the NHS is in a critical condition itself. That is according to Lord Darcy, tasked by Labour to carry out a short, sharp review of the health service as soon as they came to power. His findings show long waits in A&E are likely to have caused an extra 14,000 deaths a year, that cancer death rates are higher than in other countries, that people are struggling to see a GP, and the NHS is struggling to cope with people living longer, people's health getting worse, previous reforms to the service, and the impact of the pandemic. The report didn't go into any detail about social care. The Prime Minister responded to Lord Darcy's findings, saying people have a right to be angry and that we are failing our children. He says he has a 10-year plan to fix it, but said there'll be no extra funding without more reform. Amy Lewis has the details.
The alarm had already been sounded that the NHS is in crisis. And today a major review is warning about the serious consequences it is having on patients.
We've had some major failings and we have to address those failings. And I did report about the children's waiting in the emergency department. That has to be fixed. And similarly on the other end of the spectrum, elderly care, looking at our senior citizens, they can't be left on trolleys for hours and hours and hours. And we need to address that.
Lord Darcy's review was commissioned by the Labour government when they came to power in July. It found that the NHS was in a critical condition, with A&E in an awful state, and highlighted evidence that long waits could be causing 14,000 more deaths a year. The country has higher cancer mortality rates than other comparable nations, and the NHS has been starved of investment in infrastructure.
How are you all getting on?
Good. The Prime Minister insists recovery isn't just about extra funding, but about reform.
The NHS may be broken, but it's not beaten. So it's reform or die. Reform does not mean just putting more money in. Now, of course, even in difficult financial circumstances, a Labour government will always make the investment in our NHS that is needed, always. But we have to fix the plumbing before turning on the taps.
Not for the first time, he blamed the state of the health service on 14 years of Conservative rule. The Tories responded, saying they adapted to growing pressures.
The NHS is in fact looking after 25% more people today than it was in 2010. But the way in which the NHS is operating, the demands we are placing on it have changed over time. Of course they have. And so the Labour Party should be looking forwards, not backwards.
74-year-old Tony has been waiting for a knee replacement for 9 months and still doesn't know when his surgery will be.
It's just frustrating. It does affect me. I don't know when it is. It could be after Christmas. So if I had a date, I think that would ease it a little bit, so I had something to look forward to.
The government is working on a 10-year plan to reform the NHS. We've heard the diagnosis. Now patients wait anxiously for action. Amy Lewis, ITV News, Westminster.
Let's get more on this from our health correspondent Rebecca Barry. A catalogue of horrendous problems. Can this government deliver a fix?
Well, that's the big question. I mean, firstly, just to pick out on some of the findings which really strike me, even though I report on the NHS almost daily, this report is sobering because it not only looks at the state of the National Health Service, but also the state of our nation's health. Long-term sickness is surging. 2.8 million people economically inactive as a result. 100,000 children waiting more than a year for mental health treatment. This morning, the Prime Minister said that it was a raw and honest assessment, but I don't think you can ignore just how politically charged this is, though I think the people working in the NHS and all those that rely on it will care most about what's being done about it. The government insists that it's working at pace on its 10-year plan. They want to shift care from hospitals into the community, to move the NHS from an analogue service to a digital one, and from treating sickness to preventing it. But the Prime Minister says there will be no more money for the NHS unless it reforms to improve its productivity. The problem with that will be dealing with the immediate crisis in the NHS at the same time as trying to implement those long-term changes. A&Es in England have just had their busiest summer ever, and they're bracing themselves for a very difficult winter. Experts say that ministers just have to be realistic about the true scale of the reforms and the investment that's needed.